Welcome. I'm Nikki Young, Program Manager with the Child Neurology Foundation. Today's talk is part of our ongoing series, bringing together health professionals and caregivers to provide expert advice to the child neurology community. Each topic focuses on what we heard from our partners and our families as a top priority. Today, we are discussing advocating for the right therapies for your child with epilepsy. I'm joined by Dr. Orrin Devinsky, Director of the NYU Epilepsy Center, and 4 parents here to share their unique perspectives with the various therapies available for treating epilepsy. Welcome, and thank you for joining me today.
Thanks so much, Nikki. It's a pleasure to be here and a pleasure to welcome these 4 moms who I'm very fortunate to have the opportunity to care for their children, in most cases just one child, but at least in one case, 2 children. So these are very special moms who have, I think, as many people probably listening, have faced a lot of challenges in having a child with epilepsy and neurodevelopmental issues, which have, brought challenges not just to the child, but to the parents, to the siblings. And as you go through navigating the medical landscape, there are many decisions that come up about which therapies to pursue, which not to pursue, when to do things, and with the many expanding opportunities that are out there, the decisions become even more complex. So we'll try to navigate some of those issues and how different parents have faced those. So if I could, I'm going to ask the 4 moms here today to introduce themselves and a little bit about their children. So start with you, Colleen, maybe.
Sure. My name is Colleen Olson. I am the mother of 3 children. Catherine is 13, Aiden is 11, and Jack is 9. Catherine and Jack, so our oldest and youngest, are both patients of Dr. Devinsky's. Catherine was diagnosed when she was 3, and Jack when he was 2. They are both the first and second children ever diagnosed with a very rare genetic disorder, which happened when they were 10 and 7 respectively. So it's been a very long road, and over 10 years working with Dr. Devinsky and his entire team trying to treat their seizure disorders.
Hi, I'm Kate Pico. My 18-year-old son, I still can't believe he's 18 already, is Liam Pico. He is a strapping boy who I think you're going to see some pictures of him and you'll know immediately what his superpower is. It's his connection with animals, and we're going to get a little bit into that non-traditional treatment. And I would just like to note that his diagnosis is Dravet syndrome along with ADHD.
Hi, I'm Kelly Abramson, and my son Noah, who's now 17 and a senior in high school, was diagnosed with epilepsy when he was 6 in first grade. So we've been living with this for 11 years. He, and we'll talk about this in a little bit, did have surgery for his epilepsy, and he also has inattentive type ADHD.
Great, and I'm Megan Reynolds. My daughter Maeve is 9 years old. And Maeve had her first seizure that we knew of 3 years ago today, which my iPhone reminded me of this morning, since we happened to snap a picture of her in the hospital that evening. And so it's been a 3-year journey for us. It's been a winding road. Maeve was diagnosed, her epilepsy comes from the fact that she had had a stroke at some point in her life, possibly in utero, but it left a small infarction in her brain that is the source of her epilepsy. And she was also diagnosed with a rare form of epilepsy called ESES, which stands for electrical status epilepticus in sleep, which means that when she sleeps, Maeve's brain is particularly active with aleptiform activity. And it means that her sleep structure and the rest, the neurological rest that she receives from sleep is different from the rest of the population. So it has been a winding road as we receive those various diagnoses from the time that we first observe a seizure and getting her seizures under control, trying to treat the ESES, and then addressing some of the neuropsychological comorbidities that have come along with that, like ADHD, some sensory issues. At times we've dealt with anxiety, and other learning challenges. But we're in a good place now, and we've been blessed by the work of Dr. Devinsky and also the various therapies that we've brought along to help her on her way.
So just briefly as an overview, I think for those watching, people are familiar, there's a large range of therapies for individuals, children with epilepsy. And the most common are clearly the anti-seizure medications. These are not drugs that treat the underlying problem typically, but they're drugs that treat and help control and hopefully prevent seizures. There are many categories of drugs. There are drugs that work very well for generalized, but don't work terribly well for focal or partial seizures. There are drugs that work extremely well for focal or partial. They may do very little for generalized or occasionally make things worse. And then there are specific drugs that may work for Dravet, Lennox-Gastaut, and some other specific genetic disorders. So there's a large range of medications. And then there are dietary therapies, the most common being the ketogenic and modified Atkins diet. There's epilepsy surgery, which is perhaps the most effective therapy to cure an epilepsy if we're fortunate to have a relatively isolated region of the brain where the seizures come from, and it's an area that could be safely removed. And then there are neuromodulatory therapies like the vagus nerve stimulator, the NeuroPace or responsive neurostimulation, and deep brain stimulation. And in addition to those, there are an unlimited number of alternative therapies. Some are more mainstream, I would say, and they're not really alternative, like speech, physical, occupational therapies, but there are horse therapies, swim therapies, a number of others that are really straddle the physical therapy, but also I think provide a lot of positive emotion and connection for these children as well. So I'm going to start out with an open question, and I think for any or all of the moms to respond to, what are some of the treatment options you've decided on for your child? How did you get there? And how many treatment options did you go through before you found the ones that worked?
Well, I can go first. So with having two children with a seizure disorder, and just like Megan, our oldest daughter has an ESES disorder, which was diagnosed when she was 3. So between the ages of, I think, 3 to 11, we had tried, I've counted it up, 8 different seizure medications and or protocols or cocktails of medications. I'm pretty sure she was the first child in New York State to be approved for medicinal marijuana. We tried the modified Atkins diet with her. And honestly, for our daughter, Catherine, nothing actually controlled the seizures or changed her EEGs. So as of a year and a half ago, actually 2 years ago, she's gone drug-free. We've just decided that the benefits of the drugs weren't outweighing the cost or the side effects. So we've taken her off of everything, which was completely different for our little guy, who both of the children started modified Atkins at the exact same time. And while it wasn't effective or too restrictive for our daughter, it was a game changer for our son, where redness came out of his face. He was 2 at the time when we started it. And he started speaking almost within the first week of removing foods from his diet. And just recently have we started releasing him from that 7 years later and putting him on a more holistic and well-balanced diet. But that was a significant intervention for him. And unfortunately, we never found anything effective for our daughter. But we tried a lot.
Maybe I'll chime in next. We've tried many pharmaceutical therapies to find something to control Maeve's seizures. We've also had treatments inpatient to try to help her EEG and address her ESES diagnosis. And we've had some success with a cocktail of therapies. Interestingly, some of our success has come from the timing and the load of her therapies. So we found that she was on certain medications that didn't seem to be working, but when we actually gave her more at night, which was when she experiences her seizures, and even giving her a little bit earlier before she goes to bed, so she was metabolizing the therapy by the time her seizures were triggered by sleep. It's been an art and a science in trying to get to something that's gotten her seizures under control. And we're lucky that we've gotten to a point where she has pretty strong seizure control. Unfortunately, in addressing her epilepsy with pharmaceuticals, she had a lot of other neuropsychological things going on that we didn't know if this was from side effects from meds or from her ongoing seizures or her sleep condition. And we did introduce the modified Atkins diet and found that while it did not have an impact on seizure frequency, it had a massive impact on behavioral, her behavior, and from her ability to communicate to things like anxiety and mood. And we have kept her for now 1.5 years on the modified Atkins diet, and that has been very positive. And I'll talk a little bit later about some of the things that the complementary therapies that we've done that are more activity based, that we also find have given her a lot of, have provided her a lot of relief.
I can go next. So traditional therapies have turned out to be the best for Liam. And although he has taken over 13 seizure meds and countless combinations of those, we've struck on a good, he takes 3 medications now. And I was so reluctant to go from 1 to 2 to 3 because of the side effects. But thankfully, we found a great mixologist in Dr. Devinsky, and he convinced us to try this because you can balance the side effects. And we'll go into that in a little bit about the weight loss or the weight gain and the myriad side effects of all of these meds. We also tried some non-traditional things. We did an osteopath that I thought was helping at first, and then I think that a lot of it is psychological for the parent too. It's like, okay, this is gonna be it. I'm gonna fix it. And so I probably did some of these a little bit too long, I think. We did a naturalist, and then we got pretty far out there. My favorite was an herbalist that at the end of a very long meeting with him, he said, okay, we're gonna give him poison ivy. I'm like, I'm sorry, what? Because through the whole thing, he's talking like, I'm like, I found the man. This is gonna do it. I'm like, I was like, poison ivy? Like, yep. I'm like, how? What? Does he ingest it? Yep. Does he get poison ivy rash? Maybe. But he won't have seizures anymore. I'm like, I don't know. I'm back to the traditional meds. So we've been through a very winding path, as Megan said. I know everyone on this call has, and I think trusting your gut, and in the early days, I wasn't confident enough in that, but through these experiences, you kind of just turn around and say, geez, let's figure out the right bench and trust them. And it's made a big difference in the partnerships that we've forged with our medical bench.
I'll answer. We probably had, a more traditional, I think, start. We started with medication, as pretty much everybody does, and we're kind of chugging along. Didn't have an MRI for a couple months, and by then we were on Noah's second medication, and then he got an MRI, which showed that there was a lesion, a cortical dysplasia in the right parietal lobe of his brain. So we had this aha of there is something there. And that is when I think surgery discussions started at that point. We were told that, typically he would need to fail 3 meds before surgery would really move up we were at a different place. We weren't with Dr. Devinsky yet, but that was what we were told. He needed to fail 3 meds before surgery would become the course of action. And we were on his second at that point. He'd go on to fail the third. And he was also experiencing a lot of side effects. He went from a pretty typical average 6-year-old to really someone who had to drop out of all sports, was, completely behaviorally changed. And so there were a lot of things that, you're questioning, is it the medication? Is it the epilepsy? But, I think that I'll go into the details of surgery in a little bit, but ultimately we we went ahead with the surgery about 9 months after diagnosis, which might seem pretty fast, but I think it was a pretty clear path for us. And now Noah takes a smaller dose of one anti-seizure medication, which was his 5th one in the line of medications, and has been seizure-free since his surgery, though. So that's, really exciting for us.
Great, thank you all. I want to turn the topic a little bit to something I think all of you mentioned briefly, and the issue is medication side effects and differentiating what may be some of the child's underlying neurologic issue, whether it's from ESCS, whether it's from Dravet syndrome, whether it's from cortical dysplasia or a gene mutation, and how do you distinguish if the doctor adds a medication, goes up on a dose, you see changes? I think the tendency is for parents to always want to blame the drugs, and they're probably right 90% of the time, but obviously it's hard to know 100%, and I've certainly made mistakes in trying to link cause and effect when it's just based on time relationship. So be curious maybe for you guys, Kate and Colleen, to just comment your experiences. Kate? Sure.
As you said, Orrin, this is the most challenging part of this world for me, at least. Liam's side effects have been, just to name a few, weight loss, weight gain, attention deficit, motor control issues, sleeplessness, too much sleep, fatigue, lethargy. The list goes on. And every drug, as I mentioned earlier, the cocktail that you have created has helped that, in that the weight gain drug is balanced by the weight loss drug. So we had a few years of struggling to find that cocktail. And I remember distinctly when Liam was like, oh my God, my stomach hurts. Like, what is that? Is it what you had for dinner? Or is it a side effect from this new med? Or is it because you're titrating off of one of the meds? Or what? There's a top 10 list. And we all use this phrase, and I certainly overuse it, of it's a bad game of whack-a-mole, and there's way too many moles in our world that you're like, well, it could be that he didn't sleep well last night. It could be the underlying condition of epilepsy. It could be a recent seizure and the aftermath of that. It could be just that he's a boy growing and he's maturing. So to your point of, parents kind of 90% of the time get it right. I didn't feel like I was anywhere close to 90% of the time. I was like, I don't know what this is from, this symptom that just presented itself out of the blue. And sometimes they disappear without any change to the meds. So then you're left with, I don't know. And that, for a control person like me, I have never said I don't know as many times in my lifetime as I said in relationship to the medication and symptoms or side effects that Liam has had.
Great. Colleen?
Sure. I mean, I think for us, with Catherine going through the 8 different seizure medications, and we went through them rather rapidly, only because nothing really seemed to be working, and there wasn't dramatic side effects. We also were limited in terms of really watching her, A, because she was so young, and B, because she's nonverbal. She's still nonverbal, and her physical skill sets are very impaired. So gross motor, fine motor, she as a whole is very compromised. So really trying to behaviorally watch her and make assessments over what was what, if it was, like you guys were saying, poor sleep, if it's the food, if it's the cocktail of the food, if it's, just a 4-year-old being a 4-year-old, and just, she by nature is a little bit more of a diva, sassy personality. So how much of it was personality and pushback versus who she was, and, the therapist working with us. I mean, we were taking so much anecdotal data, and nothing really ever amounted to much, with the exception of one time pulling her off of, she was only on 5 milligrams of a benzodiazepine, and it took months to get her off of it. And the side effects from the withdrawal were so profound. I think she was 7, and she was vomiting and hostile and aggressive, which really isn't part of her. I mean, she can be sassy and kind of a diva, but she's never physical. And it was a really, really hard few months to get her off of it. where I was really blown away that we were missing or potentially missing some of the side effects that could have been underlying with her just by nature of the complexity of her disorder and how she presents, and without actually having her have the ability to respond back to us. It was just too much of throwing knives blindfolded as to what was what. So, which is how we came to the reconciliation of taking her off of all medication, that she's probably just better without anything and living through her seizure disorder.
Great. I think we already covered a drop of this, but Megan, and I think all the moms here have ventured outside of the standard medical Western box at different times to different degrees, and some of you are probably still doing it with benefits, but maybe you can talk about some of the things you've done outside the standard therapies that you think have been helpful or not.
Yeah, absolutely. I think we certainly have gone the full path of pharmaceuticals and then what I might call kind of standard therapies that come along with the neuropsychological comorbidities. So speech, cognitive behavioral therapy, occupational therapy, and physical therapy. We have gone that route kind of in with our team, with our medical team that includes Dr. Devinsky as epileptologist, but also a neuropsychologist, and feel really blessed that they have helped us find those resources that we have found incredibly beneficial. But what we've also found, I think the most kind of alternative forms of therapy have been ones that we've found through trying to give Maeve activities and extracurricular activities that are both fulfilling for her, but also therapeutic in some way. Our instinct as parents said, okay, if she is not getting proper rest while she sleeps, what can she do during the day that provides her some sort of feeling of ease? And so we kind of sought out activities that would do that for her. So that comes from, we did a therapeutic horseback riding program that is wonderful for her, and not only soothing her, she gets a lot of benefit from times with animals, but giving her confidence. We found a play group that is a Lego play group, but it's a social skills group. So she thinks it's play, but they're actually working on social skills while they play. We've done swimming, which we found incredible benefit to her, and her behavior after she swims is always different. And we take her lead on that and try to look for things. We're not trying to force her into doing things every day, but looking for things that clearly give her some sort of fulfillment. We've also done another form of therapy called integrated listening, which is another form of play therapy where you're listening to music, and that music is at certain frequencies that are designed to strengthen neural connections. And I don't know, does it work? I don't know. Does she seem happy and at ease when she's doing it? And maybe it gives some sort of benefit to her? Yeah. So we try to take her lead. We don't try to go too crazy down a path, but we found a lot of these things from talking to other parents and learning what they have found to be beneficial from their children. And we've tried different things and have gotten a lot out of that.
Great, thanks. And it makes me think, I know some physicians I could recommend maybe for that Lego play group to improve their social skills.
Yes.
More than a few, maybe. So I want to move on to a very different topic now. And Kelly, this is for you. The idea of brain surgery, which you've already highlighted, that your son Noah has gone through. But, I think for parents, it kind of goes two ways. I've certainly seen sometimes when the topic gets broached, often the first reaction is the normal protective parental reaction that as a parent, I know well too. Put your child in absolutely as far away from harm's way as possible. And the other side is that, listen, if you have a young child who's 5 or 10, and this may be something that cures this problem and prevents them from taking 20,000 pills over the next 20 years of their life, and instead can reduce that by a factor of 3 or 4-fold to a much smaller amount and reduce the seizure burden, then that becomes very attractive. And I'm just wondering how you and your husband faced that challenge and discussed it as a couple and with your son.
Yeah, and I think that when we hear, brain surgery, it is really, really scary and terrifying. I think the irony of me being very anxious about Noah's, and I delayed having having ear tubes and his adenoidectomy because I was so afraid of putting him under general anesthesia for something that didn't seem that scary, and that was 2 years prior. So then to be sitting with the 6-year-old and to be discussing brain surgery, was interesting. I think that I think Dr. Devinsky, you're right. I think there is that instinct. And then there is also this, almost feeling of relief in that there is a reason, why these seizures are happening, because I think that, most people don't have that, that smoking gun on an MRI. And that it's always kind of about weighing those pros and cons, right? About what, if the area that's causing the seizures is in a quote unquote good place where removing it is unlikely to cause deficits, that makes it so much easier to see that as a viable path. I think also, we knew the road that personally, and this doesn't apply to everybody, but the side effects of the medication and or the continued seizures had completely taken Noah's life away from him in a 4-month period. And we, as parents, looked at this, very average middle child in the center of our family he was at a small private school, and they let him continue to come to school, but I think they were kind of doing us a favor. It was not good. And so I felt like we looked at it and thought, like, the medications are not working. The side effects are horrific. And we knew that if we continued on that path, that the likelihood of us finding a solution that would kind of give him a quality of life back was so low. And so that, I think that made it, the surgery was scary, but that made it so much easier for us to go forward. I think ultimately we felt like we had a medical team that we trusted and knew that had the best interests of our kids at heart as well. And that, Dr. Devinsky was our second opinion, and we were thrilled to have him, but we had also had 2 major medical centers tell us that surgery was the right choice for our child. So ultimately that was helpful. One little side note I will add is that we were very fortunate to have a child psychologist working with Noah through his diagnosis and leading up to a surgery and then afterwards. And so she was really instrumental in helping us explain when and how to explain the process of surgery to a, almost 7-year-old. And that, it was shocking that she recommended we wait until a week before. And that we talk about fixing rather than removing. But that was a really, really helpful just addition to the surgical part.
Great. Thanks. I can't imagine that decision, but I think clearly was the right one in hindsight. And I think you knew that ahead of time too. Yeah. So for Kate and Megan, I think all families in situations like yours look at a lot of different resources. Many go on Google, which has now gone from, a big place to a universe of information, much good, much bad, and much in between. And just wondering how you navigate that space and information coming from so many places.
I can take a stab first. I think it's, I've learned over the years that the parent's role is not to be the epileptologist, the pediatrician, the psychologist. It's to gather those resources, and it doesn't have to be the gold standard. It has to be the gold standard for you and your child. A lot of times the doctor that works for one family, it just doesn't jive with my family. So that scramble to gather that team of people, and we all have gone through this fairly dark time. Liam's first seizure was at 11 months. He's had 147 of them since then. So you're dealing with that just pure fright all the time. But you've got to move forward, and you've got to get the doctor, and you've got to get this. And I found a lot of doctors early on, mostly doctors, also educators, really talked right over my head. And I I don't think of myself as a dense person, but so then you're like, oh, I'll Google that. And oh, geez, Louise, that looks scarier than I even thought. And so finding the right doctor and the right resources to me was just so fundamentally important to Liam's care and my headspace too. And it's a palpable relief when you find that team, and just be prepared. It's a pretty big bench. Like, it's not just the doctor and like Kelly's talking about the surgeon or the psychologist. It's then the education issue, which I come from a big family of teachers. And I thought, oh, I got that. I mean, how hard could that be? Turns out that it was almost harder than a lot of the medical questions that we struggled with Dravet and attention issues, finding the right school. And I swear I'm on like this 3-year cycle of, oh, we finally found the right place, the right team. And then the second year, you're like, okay, we're still doing it. It's still, and then the wheels completely fall off. All of a sudden, you just wake up one day and I'm like, oh my God, where are we? We got to scramble and do it over again. So those frustrations are tough. And I'll let Megan speak to the deep dive on the Google stuff because you have a great take on that.
Yeah, I look back over the last 3 years and I've tried to reflect on what's been the most helpful in terms of educating us and assisting us in making decisions for Maeve's care. And late night Googling and reading of medical research papers at the end of the day is not helpful. Has not been helpful for us. And I test myself now and I give this, like, if I find myself doing it, because it's very tempting, because the what if set in at night and you have time when the kids are in bed to start doing your research. And I think, okay, is this giving me more anxiety than I already have? Or is this keeping me from sleeping or otherwise giving myself critical care? And if the answer to either of those is yes, I stop and I put it down and I walk away. That's not to say that there's not valuable resources to find online. It's just, you got to make sure that you're taking care of yourself. And instead of trying to be alone on this journey, leverage the experts in your life for information. And so we have found that the resources that are available online through our epilepsy center, so NYU Comprehensive Epilepsy Center has tons of parent-oriented resources online that are talks or books or things that are geared toward parents that are in situations like you, that are coming directly from a source that you know. That those things, actually, when I look back, they had very valuable information that helped educate us. But I would also say leveraging the therapists and educators that we are interacting with to talk, not only have them interact with your child, but spend time with them one-on-one and ask, and make sure you're asking them questions, asking them for recommended sources. The most helpful information for us has come directly from that team of Maeve's therapists. And I'd say the last thing is, we have gotten a lot of benefit from parent conversations with parents that are going through things that are common to us in some way. And sometimes, it's a parent with an autistic child. Maeve is not autistic, but they have neurodifferences, and being open and receptive to just experiences has helped me learn way more than finding, an unknown, just to some resource and a medical paper online. And that was hard for me at first. I'm a very private person. I'm not someone that really has thought about opening up about things that are going on medically in our life. But I've found that connecting with other parents in a safe way has been really rewarding and given us a community. And at the end of the day, a lot of thought, little things that we could take home and think about applying to our lives.
I would, just to piggyback on that, Megan, I absolutely agree and strongly suggest that you seek out, even at that time where this is such an isolating diagnosis. We didn't know anyone, no one in our family, no one ever with seizures. So it was, I did go down that rabbit hole and stayed there for a while until there's a group at NYU called FACES, Finding a Cure for Epilepsy and Seizures. And I went to a conference on one Saturday, and I did not want to go. I didn't want to hear all this. I didn't want to do this. I didn't want to see other people. And it was life-changing just to connect, as you said, Meg, with other parents that are walking this path. And all of a sudden I was like, oh, there are other people that get it. And it's hard to find people that get it, you know, and I really encourage you to reach out to that, you know, parent network or whatever works for you as far as interfacing with other people. I think it's a game changer.
Great. Thank you both. Very, very helpful. And Colleen, I'm going to ask you a hard one. And again, I think everyone on this call has gone through this, but these journeys are stressful for the child, for children, they're stressful for the parents. And then you've got the dynamics of families are challenging enough in today's world without a neurologic issue in a child and disrupting kind of, you know, relationships between siblings, et cetera. And just, you know, how do you and Tager and your family kind of keep the family unit and make room for each other as a couple, your other children, and how you navigate it?
Sure. So, I mean, I think we, unlike the other moms on this call, our introduction to parenthood was actually quite challenging. I had a really bad pregnancy with my first child, who was Catherine. I was hospitalized. She was preemie. It was obvious from the very get-go, from the day she was born, that there were going to be some serious challenges. She was in the NICU for a month. So, you know, it like when your introduction to parenthood is that profound, you know, we had been married for like maybe 2 years. It was real, and we were babies. We were so young that, you know, it was almost instantaneous that Tager and I, my husband and I, had just said right then and there, we are the team, and we will decide who is on the team and who is not on the team, but the two of us are always the center team. And so 13 years later, you know, it always comes back to, as a couple, when you're co-parenting, you have to be on the same page with your teammate, with your partner. And so there are moments in the past 13 years we didn't always agree, and we certainly went through an onslaught of providers and therapists and doctors and before we got to where we are right now. I mean, we found, you know, Dr. Devinsky pretty early on. As soon as she was diagnosed with epilepsy, we made a switch almost instantaneously. And so we got very lucky there. But the rest of the team has kind of navigated in and out, and that has been tricky. And so working together and making sure that inherently you and your partner, your parent, you yourselves are the actual core members of your child's team, and that who you invite to be on that journey with you is someone who makes you both feel comfortable and that you both can work with. And then just taking, you know, the children out of it, really making sure that it's kind of that airplane model of put your own oxygen mask on first. So it's so hard to do, but it's so ridiculously important. I always try to take an hour during the day, especially when the kids are at school. That's truly just my time. And I prioritize, you know, selfishly myself and then my husband first, always before the children. So, you know, if they need to sit in front of Sesame Street for 2 hours so that way we can just sit and have a conversation and maybe a glass of wine, I'm totally okay with that, because it's better for everybody when you have that connection with your partner. And then when it comes to the children, it is tricky with 3 children who are so radically different in terms of abilities. You know, we have one child who, you know, is nonverbal. She has cerebral palsy. She's pretty impaired. We have a perfectly functioning 11-year-old boy. And then we have a 9-year-old boy who is definitely impaired with some significant learning and motor needs, but, you know, all different functioning. So the way we've set our family up, which has worked for us, is that the level of expectations coincides with their actual abilities. So, and my 11-year-old gets it. He is responsible for feeding the dog, taking the trash out, and emptying the dishwasher. And it's not fair or appropriate that his sister, who can't do any of those things, would be responsible for any of those home tasks. But they're all held to the same behavioral expectation that if my daughter is being a 13-year-old girl and is throwing a temper tantrum, she is easily sent to her room as fast as her 11-year-old brother would be. So, the expectations at a baseline are always the same in terms of how we treat the children, but in terms of what they're expected to contribute or their partnership in our family network varies based off of what we know that they can do. And I think it's a healthy dialogue, at least with our 11-year-old, where, I can sit there and say there are multiple forms of intellectual capabilities, and your sister is not capable of functioning where you are academically, but she's certainly pretty bright and tops you out in a couple of other places. So it lends to a healthy respect. And I think because of that, they do really well together. And also there's not a lot of infighting because minus between my boys who are roommates and, brotherly fighting. But, for the most part, we've been very lucky that with the way that we've set up our family, the kids are able to really have a nice balance and respect for each other and what they're able to bring to the table. And I would really just kind of finally add on, especially because we have one child without needs and two children who do have so many needs. And it would be so ridiculously easy for us to solely focus on the child who needs the most amount of help versus our non-disabled child. But anything that we do is never to the detriment, or our middle child is never disadvantaged because of the needs of his siblings. If it ever came down to, Catherine's speech versus his piano lesson, and I don't have the childcare and I can't get everyone every place, of course, he's going to have to skip his thing to get his sister to where she needs to be. But one's needs will never outweigh another one's needs. We work really hard to make sure that no one is ever put out because of the needs of the siblings in any capacity. We really try hard to make sure that there is a healthy balance of who is getting FaceTime, who's getting attention, who's getting what they need, and that they're always getting at least a basic level of what they need.
Great. And in closing, I think, and can open this up for Kelly, Colleen, but Megan and Kate as well, just lessons in hindsight. I think everything you've said today is part of this, of going down rabbit holes, of, pursuing some therapies that maybe you shouldn't have, or how to get opinions, but just, having all of you have gone down a remarkable road, a challenging road. And from my perspective, having seen many hundreds, if not thousands of parents, I think you've done an exceptional job for your children mostly, and for yourselves as well and your families. But what would you share with other parents who may be early on this road that you guys are now veterans for?
I'm happy to take a shot at that, Orrin. Probably at that conference I mentioned earlier, one of the panelists, a very wise doctor, said, try and spend as much time on your child's strengths as you do on their challenges. And my reaction at that time was like, oh yeah, good luck with that. And I reflect on that, maybe not a daily basis, but pretty close. And Liam's been seizure-free. I'm very happy to reveal that he's been seizure-free for close to 4 years. So the evolving nature of your child and who they are over the years changes. And it's so hard to keep up with that. I have this static approach to, okay, we've conquered that. And then you look and there's another thing on the other side. And I lose sight of all of his myriad strengths, and I think that's wise. And I think a lot of us on this call have done things like horse therapy because our kids' strengths come out in those kind of therapies. And for instance, Liam with ADHD, if he was standing here, would have trouble counting to 10. He's on his horse, he's trotting, he's posting up and down, and his trainer says, okay, 1 to 100, Liam, and he's 1, 2, 3, 4, 5, does not miss a digit to 100. And that, as a non-medical person, I'm fascinated by that. And my take on it is the horse is his feet. He has so many balance issues that he's worried about walking into the wall or breaking another toe when he's walking on solid ground. But his feet in stirrups, and he is the happiest kid I know. So focusing on those kind of, and they're hard to find. I don't mean to make light of it like, oh yeah, it'll be easy. but I think that was a big deal for me. And the other two are things that Dr. Devinsky has said in the past. And Colleen touched on this, and it cannot be dismissed as to children need discipline. I need discipline, but children need that, and they need to know their boundaries. And I found over time that I was more lax with Liam than I should have been. So at about the age of 10, I'm like, who's that kid? What happened to my cute, adorable little boy? And so we waved in behavioralists because we do have that bench where you can call somebody and say, I don't know who's screaming in the corner, but it's not my child. So I think to just keep in mind, treating like their typical peer group is really important. And that builds independence for them. And I'm the first mom to admit that my child's 18, and some mornings I'm so frustrated, I'm still putting on his shoes, which isn't fair to him, and certainly not fair to me. But anyway, that's my take on what I would suggest to young parents.
I think,
oh, sorry.
go ahead.
Oh, sorry about that. A couple thoughts in terms of surgery. I think in a lot of ways it can be presented as a bit of a slam dunk, and you do the surgery and then you kind of wrap all this stuff up in a nice, neat bow and move on with your life. And even though I'm thrilled that Noah has been seizure-free for 11 years, I wish I had known going into it. And the signs were there, but sometimes we hear what we want, that, it is a long haul diagnosis, even if you have a successful surgery. There are academic challenges, behavioral things, deficits that may have been there from the epilepsy, like a slower processing speed and things like that affect all areas of their life. So, there will still be following up testing. There will still be tweaking medications. There will potentially still be academic difficulties. And my one other piece of, advice, I think, is to, whenever possible, to have another adult at as many appointments as you can, and to have a notebook where you write everything down. I mean, it definitely became really relevant as we were in the hospital during those 3 surgeries, or even leading up to it. But I find that we all, don't hear everything that a doctor might tell us. And so having another adult there, and then having your notes, and being able to go back and kind of digest what you heard and make sure you all heard the same thing, can be really, really helpful in the process.
I think my add-on would just be, typically as a parent, I always say, trust your gut. I remember when, when something doesn't feel right, especially with our youngest child who had a healthy pregnancy, and unfortunately I was right, but you need to trust your gut. You need to build a really great team, regardless of, like Kate said, what works for some families doesn't work for all families. So collecting as many resources and building your team that works for you and your spouse and that works for your child is the most important. And then I think finally, I think for me early on, I was looking to individually just cure my child, and that you're looking for treatments, that you're looking for viable treatments. But like Kelly just said, it's a really long haul, that you're not curing anything. You're just looking to ease the issues.
I've kind of adopted a mantra of progress, not perfection. And I think I wish I had held onto that earlier in the early days, to what Colleen was just saying. I was looking for the cure to happen tomorrow, right? Like I wanted this was going to be the last seizure, and that's it. And school was going to work and everything was going to just fall into line. And I shifted the mindset somewhere along the way, and to just progress, and to what Kate's saying, kind of focus on the good. Like there is progress. Celebrate where you have little wins, and put one foot in front of the other. It's a marathon. Can't do it. Keep yourself energized for that marathon, and just keep moving.
Well, I just want to thank all 4 of you for being here and sharing a lot of personal and challenging times that you've had. And it reminds me of something I think I realized somewhere in the first decade of my career, in seeing some child who I think had cerebral palsy, had minimal verbal skills, and I think I was having a hard day or a hard week in my life. And I just realized that this child in front of me who has extremely limited mobility, limited cognitive function, limited speech, I think is happier than I am. Just the things that bring them happiness. And I think for parents, it's important to recognize that, yeah, some children, for fates that are out of all our controls, may not have the language or intellectual or athletic or motor skills that other children have, but they may be the most happy people you can imagine. And I think that is a realistic goal for so many of these children, and not to impose preset ideas that, kids are born and parents are like, I hope she or he gets into an Ivy League school. And sure, that's a nice thing, but that doesn't make anybody happy. I can tell you that. I've seen examples all through my life of that. But you want them to just be, secure as much as you can and loved. And I think you have all done an amazing job at that. So thank you.
Thank you.
Well, thank you all so much for joining us today and sharing your expertise with the child neurology community. For those that are watching, for more resources, make sure to check out CNF's website at childneurologyfoundation.org. Together, we are all child neurology.